So I'm joined by Kirsten for an interview again. Thank you, Kirsten, for taking the time to interview.
Problem.
Firstly, could you just give us a little bit of a background into your experience and how you got into being a practice nurse, when you first started, and just your experience in this industry so far?
Sure. I've been a qualified nurse for about 32 years now. Worked on surgical wards and medical wards, coronary care. And then when my children were born, I went into practice nursing, so about 22 years ago. I had a bit of a break and then came back about 5 or 6 years ago, back into general practice.
In terms of pilonidal sinus disease, this is what this interview is about. It's what you treated me for a very long time. When did you first come across pilonidal sinus disease, and how do you think it's changed since you last saw it?
I first came across it when I was a student nurse working on the surgical wards. We used to have lots of mainly young men coming in, sort of late teens, early 20s, for surgery, but I'd only ever seen the sort of acute surgery and then they're sent home. And then when I went back into nursing, I've seen it much, much more, particularly in the last probably 5 or 6 years. I see it often, every week.
Really? How do you think it's changed, or in terms of, I know we're going to touch on aftercare in a bit, but in terms of the whole process of pilonidal sinus disease, has anything with the surgeries changed? Do you think there's been much of an improvement over the last, say, 20, 30 years, or is it kind of stagnated?
I feel like when I see what sort of surgeries patients are having, it feels like very similar to what I was seeing 30 years ago. I think maybe some of the wound care might have changed. Hopefully that's improved. But I haven't seen a real change in the surgery itself.
In terms of the aftercare process, that's what you're heavily involved in.
Yeah.
That's what you help so many patients get through when it comes to, the aftercare process of pilonidal sinus disease.
Hopefully.
So, you definitely do. So, what are kind of the key things that you look out for the aftercare process, whether that's things you can do yourself or whether the patient can do to make sure that they have the best chance possible of healing at the best rate?
Sure, the way I look at it, you have to look at the patient as a whole. So when they first come in, they've just had surgery and they're probably going to come in for daily dressings. So it's the simple things like how are they going to get here, who's going to bring them, who's at home to support them. They need education about things like diet, exercise, hydration. So diet, I'd always try and encourage vitamin C in their diet. Some zinc is good for wound healing, and a high protein diet as well. So it's often, as I said, young sort of teens and 20s, so it's often avoiding the takeaways and things like that. Alcohol is another thing to bring that right down. Smoking, it's a hard thing to give up at a crucial time, but that would be something else. It's important they keep hydrated. You don't want to get constipated when you've got a pilonidal wound. So I'd encourage lots and lots of water. Exercise, very difficult in the first few weeks. Often you can't do a lot at all. So I'd encourage some yoga stretching. I think I learnt through you, Frankie, that you ended up not being able to sit down for a long time. And I think had we done that at the beginning, that might have helped you with your stretches throughout. Encouraging them to be really meticulous with their hygiene, so important. The other thing would be talking to somebody about posture, because at the beginning you don't want them sitting flat on a chair, so you'd be encouraging them to sit side to side, or getting one of the special seats, a donut ring or a coccydynia chair is always helpful. But as soon as they can, getting out for small walks and things like that, really important, keep them mobile.
Yeah, I guess in touching on that with the exercise, obviously you don't want to rush back into things. As you mentioned there, the type of person coming in with pilonidal sinus wounds are usually kind of early teens, late teens, going into the 20s. So for me, exercise was a massive part. I was playing football, I was going to the gym, had to kind of stop that. So what kind of advice would you give to someone that you might have some really active people that then have to stop things? Is it just small and often walks and just gradually getting back into it, building up the confidence and hopefully the healing process as well?
I think you talked about confidence there. That's really important, because with a big wound or pilonidal sinus wound, it's frightening for patients. Nobody talks about it, so they've got this injury or surgical injury that they don't know anybody else has had because nobody's discussing it. So giving them the confidence that things will get better. It may take time, normally at least 2 to 3 months, but sometimes, as you know, a lot longer. So getting them confident in what they can and can't do. Encouraging them to come for their daily appointments at the beginning and then spreading them out as things get better. Giving them some emotional support, maybe in the appointment themselves, you know, seeing how they are, what they're getting up to, what they're not able to do, but sometimes referring them on to somebody else if they need some talking therapies, things like that. You know, you'd be surprised how often people struggle with this sort of trauma.
Well, that kind of leads me on to my next point, which is the psychological impact of pilonidal sinus disease and how difficult it can be for someone who's going through it, a patient going through it, because we've said it before, but it's not the sexy kind of wound or procedure. So it's not something, it's not in an area as well that's a comfortable area. It's something that patients often don't want to talk about. So talking about pilonidal sinus disease when they have it is something they probably find quite difficult, and it does take its toll on the whole process. So how do you encourage patients in that aftercare process to talk about how they're feeling when they come, whether they're coming in, whether that's with family members, friends? What do you encourage as a practice?
I think I would always try right from the beginning to make a really good rapport relationship with somebody, letting them know that this is not something that we hardly ever see. It's, you know, I'm seeing it regularly in the clinic, so letting them know that they're not the only one. Maybe giving them some information where to go for help, but as you know, there's not a lot around. Getting a family member or girlfriend, boyfriend, whoever coming in with them to the appointment is always helpful as well, because then somebody else can see what somebody's going through. That's always quite nice. But I think open communication is really, really important.
Do you think the psychological side of not even just pilonidal sinus disease in general, but the aftercare process when you've gone through a surgery is not overlooked, but it's maybe a concept that isn't treated as a high priority because it's so much emphasis on the physical healing of the wound rather than the emotional, mental impact it can have on someone? Do you feel like that just in general needs to be a wider discussion and more open conversation?
Definitely, I really do. I think, you know, the way healthcare is run now, everybody's so busy, taken over by tasks. Like you say, you're going in for an operation that you want something to be mended, but then it's the after effect that is almost often harder than the surgery. So I think time does need to be taken to look at that. People often go home and don't know what to expect coming forward. So I think even just a little bit of a chat in hospital about what the patient's going to expect for the next 2-3 months, potentially more, it's really important. Prepare someone for what they're going to go through.
In terms of the actual wound cleansing and, you know, the packing of the wound, dressing of the wound, that can be, again, it depends on case-by-case basis of the type of wound, how deep, the position, but it's obviously something the patient can't really do themselves because of the location it's in. Do they have to come into the GP each time they need to have a dressing change? Can it be taught for, say, a family member, a parent, if they're living at home with their parents still, or a partner to be able to do it? Is it a kind of more simple process, or would you always recommend someone comes into a GP practice?
I think at the very beginning, coming in, you know, getting the wound properly assessed, but then once the patient is feeling more confident, that we talked about, and if they have a relative that's willing, you could certainly train them up to help out at home. Things like dressings at weekends, what do people do? They often have to go to a walk-in centre or travel a long way to A&E. So I think having somebody at home is really helpful to us, but also the patient. That involves quite a bit of training. You know, if somebody's not a nurse or a doctor, they're not going to know how to do wound care. So it would be training them up on how to do it. So getting them to come in and watch the dressing as many times as they need to feel more confident, and then actually doing some hands-on work. So getting the mum or whoever to do the dressing in front of the nurse, showing them exactly how to do it, making sure they've got the equipment at home. So giving your dressing packs and your actual dressings enough for home. Simple things like how would they dispose of the dressing, so going through that with them. I was thinking the other day, you know, a virtual contact. So if somebody's off and the mum's doing it for a week, then you need to have some contact still with the surgery, and also safety netting for signs of infection and things like that. So definitely I think it's helpful to the patient for various reasons to have someone being able to do it at home, but they do need that support and training first.
In terms of pilonidal sinus disease, the whole point of this website is to raise awareness and almost become an information hub for patients to go to who are going through that aftercare process and experiencing the things we've just discussed. So how do we continue to shine a light on pilonidal sinus disease in general and, you know, continue to talk about it as a disease? Because as I said before, it's not the sexy procedure for surgeons to learn, often quite a neglected procedure, and there's so many different ways someone can have a surgery for it. So how do we keep raising awareness and pushing people in the right direction for it?
I think you're absolutely right. You know, as I said before, people just don't talk about it. Most patients that come in for the first time with a pilonidal sinus had never heard of it before. So I think opening that communication, really, you know, sharing your stories with your friends and relatives, really important. We didn't used to talk about things like menopause, but we do now, so hopefully that can come forward. Using social media, really important. Joining support groups, even online support groups, you know, blogging about your experience, reading articles, sharing the articles with people, but it's all about communication. I think in healthcare as well, I try amongst the staff here to discuss pilonidal sinus with the other nurses and healthcare assistants so that they feel confident doing it, because if they're not seeing it a lot, they won't feel it. So training the staff around me, but really I think it's talking, chatting, sharing your experience.
Yeah, 100%. Well, that was amazing, Kirsten. Is there any kind of final thoughts you have on, you know, pilonidal sinus disease, the aftercare process? If there are patients out there who currently are going through that process, any last advice for them or things to look out for?
I think you know, giving them the confidence for what they're going through is normal for people going through this procedure, and it will get better, but it will take time. It's not an overnight fix. You know, they can sometimes come back, but helping them learn how to prevent that's really important. So maybe going through hair removal, particularly in young men, they may need laser at some point. Again, the hygiene, really important, good diet, exercise, not sitting in the same place for a long time. Spotting things early, really, really important. So, you know, as soon as they get pain, swelling, soreness around that area, to come in and speak to the doctor, not leaving it. Quite often people will leave it till it's, you know, a big abscess. But I think it's all down talking.
Yeah, 100%. And yeah, we're going to continue to do that. And yeah, obviously really appreciate what you've done, Kirsten, throughout my personal journey as well. So we're going to continue to push that on pilonidalsinushub.com as well. So amazing. Thank you so much for your time, Kirsten.
You're
really
really
appreciate
welcome.
it.
Thank you, Frankie.
Thank you.